Good morning, everyone. The topic that we're going to see today is nutritional management in bariatric surgery. In the previous classes, we had seen about the various obesity or weight management strategies, and bariatric surgery is a procedure which helps you to manage obesity. Let's go into the topic. So, what is this bariatric surgery all about? Bariatric surgery is a gastrointestinal surgery that is done to treat or manage obesity. It is also called as a metabolic surgery because it treats the metabolic conditions associated with obesity such as diabetes, hypertension, dyslipidemia, sleep apnea, and all these conditions. So, for whom is this bariatric surgery suggested? People with a grade 3 obesity or BMI of 40 or greater, and another category where people have a BMI of 35 greater with comorbidities associated, and those people who have failed to lose weight through a comprehensive program which includes calorie restriction, exercise, lifestyle modification, counseling and nutrition education, along with pharmacotherapy, wherein the medicines for obesity, handling obesity would be given. So when a patient fails to lose weight through this comprehensive program, they are suggested to have a bariatric surgery. And when a patient is not able to reduce the body weight by 1/3 or body fat by 1/2, then those people can also do the bariatric surgery. And if suppose the people are able to bring about weight loss, but if they're not able to maintain that weight loss achieved, then they can also opt for a bariatric surgery. So this bariatric surgery is usually performed in between the age group of 16 to 65 years. And what also happens is the new stomach capacity after the surgery is only 30 ml, and it reduces the body weight up to 40%, and also it treats hypertension, type 2 diabetes mellitus, non-alcoholic liver disease, dyslipidemia, and sleep apnea. So next, we look into the various types of bariatric surgeries. So gastroplasty is also called as a stomach restricting procedure, which decreases the amount of food entering the GI tract. And while gastroplasty is a restrictive procedure, Roux-en-Y procedure is both restrictive as well as malabsorptive, which means it decreases the absorption of nutrients. So before the surgery, the patients have to be evaluated extensively. The previous medical history, physiological conditions, medical complications, poor self-esteem, depression, and these psychological problems have to be addressed. When considering the post-operative follow-up, it is very essential for bariatric surgery patients. It has to be done at regular intervals, as well as the surgical team which has performed the operation and the registered dietitian should follow up the patient at regular intervals. Both behavioral as well as psychological support is necessary to maintain the weight after the surgery. Now, Let's look into the types of bariatric surgery. The first type, gastroplasty, as we had already discussed, is a restrictive procedure. Can you see the row of staples? The row of staples which are being made creates a small pouch in the stomach. So this is a procedure which is very well known among the medical field for bariatric surgery, and one of its type is called as lap adjustable gastric banding, which means this pouch can be increased or decreased with the help of a port that is attached here. This port is filled with saline and it can be used to increase or decrease the capacity of the stomach. So both these procedures are restrictive in nature. And the next procedure that we're going to see is the sleeve gastrectomy, where the antral portion of the stomach is trimmed and the stomach section is removed, where you create a small sleeve and the food capacity is reduced to only the food capacity which is entering the stomach is reduced to 30 ml. And this is the most commonest of procedures, which is called as gastric bypass or Roux-en-Y gastric bypass. So here what happens is the stomach is cut as a pouch and an intestinal loop is attached to it. So here the duodenum is attached to the small portion of the stomach, and this procedure is called as Roux-en-Y gastric bypass procedure. Once the bariatric surgery is performed, then the role of good nutrition plays an important role in the recovery of the patient and maintenance of the lost weight. So here, bariatric surgery, as we all saw, the capacity of the stomach has already reduced to 30 ml. So it completely alters the anatomy of the digestive system. So the nutrient absorption as well as metabolism is totally affected. So here the importance of good nutrition is essential because to prevent the loss of lean body mass as well as to prevent a lot of nutrient deficiencies and to improve the health and well-being after the surgery. So personalized nutrition plan is very important. So what is this personalized nutrition plan? Each patient is different and the side effects of the surgery is not going to be the same for everyone. So when you provide good nutrition for the patient, then it can help in overcoming the effects of the surgery. Now let's look into the different types of nutritional recommendations for people with surgery. Okay, so here the first step is in the evaluation of the diet that you're going to give. So this occurs before the surgery is performed, which is called as the pre-operative period. And the second step is the post-surgical diet progression, the kind of diet that has to be given after the surgery. And then comes the follow-up recommendations, which is the routine screening of the patient after the surgery. Let's look into the pre-operative dietary recommendations. So a low-calorie diet about 650 to 800 kilocalories is prescribed for about 2 to 6 weeks. So this prescription of a low-calorie diet depends upon the patient's weight before the surgery. About 3 to 4 kgs of weight loss should be achieved in 2 weeks, or 20% of the weight should be reduced before the surgery through this low-calorie diet, because it reduces the complications in the surgery. A liquid diet is given for this period, which is high in protein content. So because of the restrictive diet, the micronutrients, both the vitamin and mineral bioavailability decreases. So this pre-operative dietary recommendations is to facilitate ease in the procedure of bariatric surgery. Now, after the surgery, how do we provide the diet for the patient? So the three primary principles are: after the surgery, you start with a clear liquid diet, which is easily tolerated by the patient. Based on the improvement in the tolerance levels of the liquid, the patient can go to a full fluid diet and thereafter a semi-solid diet and a solid diet. When it comes to protein intake, the protein intake should be from high biological value proteins. Lean meat, eggs can be given, and sprouted pulses, nuts can be opted for the protein intake, but that is in the progression stage. So in the initial stages, there should only be the liquid diet, as well as the facilitation can be done later. And then the most important part is the portion control. When you look at the plate, we have introduced all type of nutrients which from the food groups. So there is some amount of carbohydrates, proteins, and fruits and vegetables, and hydration is equally important. So there is no restriction of any one nutrient after the surgery. All the nutrients have to be provided, and the key here is to have the portion control. The size of the amount of the food that you eat is very critical, because the size of the stomach is completely reduced. If you overeat, it can result in nausea, vomiting, or diarrhea. In such conditions, you will have to have a small frequent meal with proper chewing of the food, and intake has to be regular in small amounts. Since the patient will not be able to eat large amounts of food, and if the food is restrictive, then the patients can go on to micronutrient supplements. Now let's look into the 5 phases of diet after the bariatric surgery. The first stage is called as the clear liquid diet, which can be given for about 5 days. As the name suggests, the foods that you're providing here has to be only made of liquids, and it has to be strained thoroughly. Tender coconut water can be given, strained buttermilk, strained fruit juices, thin soups can be given depending upon the tolerance of the patient. This diet can be given 5 days after the patient has started to accept the oral intake of foods. Then the second phase is called as thick liquid diet, where you slightly increase the consistency of the liquids that you're already giving. So mashed fruits and vegetables can be given, mashed dals can be given, and broth soups, both vegetarian and non-vegetarian, can be given, and fruit juices which are strained, it can be in the form of shakes. Those foods can be given in the stage 2. When it comes to puree diet, it is nothing but the blenderized diet. So this will be given for the next 5 days. So here the rice and curd which are blenderized or pureed, or thick rice porridges, dal, rice which are completely pureed, can be given. And then coming on to the phase 4 is called as the soft diet, which is easily digestible and easily chewable. So foods like idli, idiyappam, depending upon the regional preferences of the patients, can be given. And the phase 5 is the normal diet, which is what something similar to that we eat. So when you consider the water requirement in all these stages, the phase 1 and phase 2 will require 1.5 to 2 liters of water, and gradually the amount of water can be increased in the subsequent phases. And the physical activity can be started from the phase 2, where the patient can have 30 minutes of walking, increasing in the phase 3, phase 4 and phase 5 to 45 minutes of walking. So the tolerance is the most important factor here. Depending upon the patient's tolerance, the consistency of the food can be improved, and the nutritional availability as well as the considerations can be considered only of the patient's tolerance. Now, let's look into the macronutrient requirements after the surgery. So the most important group of nutrients that we have to ensure that the patient is having properly is the protein intake. So protein intake is calculated at 1.1 to 1.5 grams per kg ideal body weight, and it can be gradually increased and reached up to 90 to 120 grams of protein per day. The important amino acid that we have to consider here is leucine, because it maintains the lean muscle tissue. The foods that are rich in this leucine content are eggs, lean meat, lentils, as well as whey protein supplement. So these things can be included in the diet of the patient. When it comes to carbohydrates, it is very essential to keep this simple carbohydrate in mind. It has to be totally avoided at any cost. And when it comes to the dietary fibers, it has to be gradually increased after 1 month post surgery, because the fiber keeps you full, as well as it brings about healthy eating as well as good gut flora. So the patient also has to have this mindful eating in this mind by eating. So mindful eating is basically knowing what you eat. You will have to chew it well, as the digestion process begins in the mouth, and the choice of foods under each food group is very important. When it comes to fat, 15% of the total caloric intake can come from the fats. Here you can provide essential fatty acids that can include omega-3 and omega-6 fatty acids, as well as mono and polyunsaturated fats. Saturated fats have to be reduced, and trans fatty acids has to be completely restricted. Okay, so after the prescription of the diet, the most important thing that we'll have to consider here is the patient's assessment after the provision of the diet. So the complications which can arise after the surgery includes malnutrition. If a diet is not enough or adequate for the patient, it can immediately lead to malnutrition and loss of lean body tissue. So at regular intervals, the assessment for malnutrition has to be carried out. And because of a restrictive diet as well as the restrictive physiology of the stomach, there could be a possibility of a lot of micronutrient deficiencies. In such cases, a micronutrient supplement has to be given on a day-to-day basis. Then, coming on to this dumping syndrome. In the Roux-en-Y gastric procedure, when we have seen it, there is a restriction in the stomach capacity, as well as the nutrients are not absorbed properly. It results in malabsorption. So dumping syndrome is one of the important cause for it. So in dumping syndrome, when the food reaches the intestine very quickly, it results in this dumping syndrome. So it can lead to symptoms like nausea, vomiting, abdominal cramps, bloating of the stomach, and other complications that decreases the food intake. So the remedial measure for clearing this dumping syndrome is to separate the solid foods and the liquid foods, and proper chewing of the food as well as eating small frequent meals. A patient after the bariatric surgery can be given 8 to 12 small meals larger than 3 bigger meals. And SIBO, which is called as small intestinal bacterial overgrowth. Because of the surgery, there can be an excess of the pathogenic bacteria that grows in the intestine and it can cause acidic diarrhea. So here what happens, the mode of treatment is by giving a broad spectrum antibiotic which can clear the microbial infection. And also providing probiotics can be helpful in relieving small intestine bacterial overgrowth. So these nutritional complications are very common in a bariatric surgery. So these things have to be kept in mind while planning a diet. And coming on to the follow-up recommendations. So physical activity is very, very important. So if the patient has to maintain the lost weight, then physical activity is indispensable. So it prevents muscle depletion, it maintains the bone mass as well as increases metabolic rate that can burn higher amount of calories. And before starting a physical activity, proper medical authorization is required. Aerobic exercise can be done for 50 minutes, 150 minutes per week, and the long-term goal can be 300 minutes per week. So it has to be a gradual increase and not a sudden increase. Hydration is very, very important. 1.5 to 2 liters of water should be drunk on an everyday basis. And the patient has to definitely maintain a food journal or a food diary. So there will be a lot of foods which could have been tolerated before the surgery but not after the surgery. So when a patient eats a food that is not being tolerated by him or her, then he will immediately have a gastrointestinal symptoms. So when the patient notes down such symptoms in the food journal or food diary, it is easy for the dietitian to recommend alternatives and to prevent any kind of nutritional deficiency. And nutrition supplements is an integral part of a bariatric surgery because of the food amount that gets restricted, supplements are key for providing the micronutrients, both the vitamins and the minerals. And apart from that, the general lifestyle modification should be avoiding of tobacco, smoking and alcohol. So now that we have come to know about the pre-operative diet, post-operative diet, now it's time for a small activity. I would request all of you to divide yourself into groups of 5 and 2 groups would work on planning a pre-operative diet for the bariatric surgery who's going to be admitted for a bariatric surgery, and the patient who's got a surgery done, you will plan a diet for him. So we will have a discussion on this activity in the next class. Thank you.